Modern medicine is truly something to marvel at. I mean, over the past 100 years alone, we've made so many advancements in terms of surgeries, treatments, and even medical devices. But it wasn't always like that. I mean, prior to 100 years ago, what were people experiencing in terms of medicine? What were they getting? What kind of surgeries did they have to deal with? Heck, what about 1,000 years ago? What did medicine look like then? Well, all those questions will be answered today because I got my hands on a lot of these ancient medicines and medical devices, so we're gonna be checking out each and every one of them with a special guest. So without further ado, we have a lot to do, so grab your popcorn and let's do this.
So we have a very special guest for this video because of course it's themed around medicine, 1,000 years of medicine, and so we have Dr. Mike.
Hey! Oh wait, what's going on?
What's up, Dr. Mike?
I'm here to educate and perhaps do some fake surgery.
Yes, so let's do this. So we're starting off with a lobotomy device. So lobotomies were a popular medical trend, I suppose, in the 1900s. Now they're viewed as extremely unethical, but we have with us some orbitoclast medical devices and surgical tools. Now, have you seen these before?
No,
are you familiar with them?
Not only have I never seen them, I've never even seen one performed outside of some ancient medical show.
I did prepare some
You got
gloves.
gloves.
Now,
Okay.
I wanted to ask, are these the gloves that you'll use, like non-sterile disposable nitrile gloves?
Yes,
or?
this is actually the correct glove. I actually had a patient yesterday make sure that there was no latex in it because she had a latex allergy.
Oh, great. I
So
actually
that's why
got
we went to
latex
these.
also in case those.
Well, for our patient, we should probably inquire.
Right. Okay, so let's start with this lobotomy. I guess I'll be like you'll be the attending, and I'll just be like a student.
We're both students.
We're both students?
Yeah,
Okay.
I mean, this is not something I learned in medical school.
All right, so through the orbital plate, which you access through the eyelid, and then you pierce the frontal, temporal, parietal, occipital. So it would be the.
Okay, so you have the parts down.
And then you want to
what is
disconnect neural pathways.
Yeah, that's the question. How do you know that you're aiming it in the right direction?
I don't know.
These days, I even give injections into joints for with steroids to reduce inflammation in athletes and stuff. I do it under ultrasound guidance to make sure I'm going in the right space. They're going into brains with this, and they're like, yeah, I think I got it.
I guess the hammer is to hit it in like an ice pick kind of,
exactly.
right? Oh, these are the actual tools. So Freeman, I remember, was the original
Morgan?
doctor. Yeah. Oh no. He was probably alive during that point. Should I perform it?
Yeah, I mean, this is what you were born to do.
I don't really have the steadiest hands for this.
Introduce yourself to the patient.
Oh, yeah. Hello, my name is, I don't want to say doctor because that's disrespectful to the profession. My name is...
Doctor in training.
I'm a student doctor in training. I probably will never get there. I've never taken an MCAT or any sort of course. But what I'm going to do for you is solve any sort of mental illness you have because it's the 1950s and this is something that was actually tried on people.
Okay.
So does that look like a good area to start?
It does, but I would aim it like
Okay, gotcha.
because you're trying to pierce the superior portion of the orbit. Oh, there you go.
Am I getting it?
You're getting the penetration. When you get to the bone, I feel like it's going to be the hardest part. You're in the easy section.
That's not encouraging because it's pretty tough.
I also wonder if they just jam it in first, and then when they get to the bone.
Right, that would make more sense. Okay, well, since he's not conscious, I'll start doing a little bit of twisting just to get lower. There we
How's
go.
it going?
Oh, I'm
Yeah?
in there now.
Okay.
Yeah. I'm just gonna start banging. If we don't get it, we don't get it.
Yeah.
It's probably for his better too. We don't actually get in his neural networks.
Well, does he have? Is there brain tissue in here?
I don't know. I guess we'll find out.
Find out right now.
This is my first with the head.
Sever the brain.
Getting in somewhere.
I see the point going in.
And then do I just wiggle around?
Yeah, like once you're in the goo, aka the cerebral frontal cortex, I think you just mash.
But what's the feedback we're getting to know if something's working?
Ask the patient.
Oh, is he? He's. Yo, you good?
Reassess.
This is terrible. This is so archaic. I'm glad that this doesn't exist anymore for obvious reasons, but the fact that somebody thought in the first place this was a good idea is just crazy. All right, well, poor guy, but this is just the beginning.
Yeah.
All right, so I'd say successful. So
Yeah,
I'm just gonna pull it out.
Right?
I mean.
There you go.
All right,
Doctor,
good job.
Well done.
Thank you. So this next device is actually the oldest known surgical device out there. From the ancient 7000 BC times, we have a trephine. It's used for trepanations and used to relieve pressure. So back then, if somebody had a headache, maybe a migraine, what they would do is basically insert this into the skull and then pull out a small piece of the bone.
So much can go wrong with this because immediately under the skull, you have meninges, which maybe you would know from the term meningitis.
Yes.
When they get infected, you can get a lot of pressure buildup, a lot of problems in the brain. This could damage the meninges. This could cause massive infection, massive bleeding if you go too far. So I don't know how they were measuring how to do this.
All right, I'm gonna go right. Oh, well, I guess I should have.
Oh yeah, introduce yourself.
Hey, now he's looking down. He's on his phone and stuff. All right, I'll take that as consent. I highly doubt I'm able to penetrate with this. Sorry, buddy. This is gonna help you, hopefully.
Oh, there you go.
Oh, I'm getting in there. I don't know if I'll be able to get through the bone.
Skull, yeah.
All right, should I check?
Yeah, check.
Oh, nothing.
Oh, but you got some.
Oh, okay.
Maybe that's got to come out first.
Wow, look at that. Poor guy.
Well, at the very least, you did a punch biopsy.
Okay, that's good, right? I'll give it one more go. If not, then we have some other devices that will certainly get through the brain. Like, does bone density extend to the skull too? So if somebody has like 2-3x normal bone density, is that throughout the body?
I think you don't want to have 2-3x bone density. Anytime you're moving away from the norm in the human body, it actually creates problems.
Okay.
So just like you've heard of a condition called osteoporosis, that someone has weak bone,
Yep.
right? Especially women as they age, they develop osteoporosis. You could have osteopetrosis, which is where the bones are actually too dense, too stiff, and they're almost like shatter-like. So that they break even more easily.
I see. Okay. So not good that you're too.
You want to balance.
So maybe he's just not a good patient for this device.
They didn't design this device well. No.
Okay, well, we tried. But that's what it's supposed to look like. Dud device then, I guess. But the oldest known surgical device, so I'll give it a little bit of grace here. So this next device is called a curved bone saw. It was used during the Civil War primarily because if anybody needed a quick amputation, apparently within 2 minutes, they were able to just manually get through most limbs.
Wow.
Which you wouldn't think for a device this small, but I guess it's like when you're in crunch time, the adrenaline going, it would work out.
Literally crunch time.
Yeah. So we have a human hand replica here. So we're gonna try to sever a finger pretty quickly. I'm just gonna try to cut it like a knife.
Yeah, so let's imagine this person came in, they have gangrene on their finger, there's a terrible infection that you don't want it to spread to the rest of the body. We have no antibiotics because we're in the Civil War, so we need to get that off.
All right, so he needs this immediately.
Yeah, immediately. Oh. With the bone saw. This is not an operating table.
Wow, this guy's also 2x bone density.
Yeah, a lot of bone density. Can you imagine what was going on back then that this was their solution?
Yeah,
there's no way this is medically accurate.
This can't be right. Also, his body wouldn't be able to twist this much. Oh, there's the wire at this point to hold it together. Okay. All right, so
that's cheating.
I guess I technically did. That bone is detached.
That's a detached bone.
There's just a wire to like really keep it together, but this finger's off here, just for the visual of this.
Yeah, you went straight through the DIP.
There it is. His other finger's may be broken, but at least we saved him from the gangrene.
Sharp on the field. You have to always announce when you put a sharp object down, live sharp. So if you put that down, you have to announce live sharp on the field or dispose of it in a sharps container, which I don't see here.
Okay.
So this is technically, we're warning everyone in the room. Gorilla, you hear that? Live sharp.
All right, live sharp. All right, so this next device is also an amputation saw, but this one is for the heavy duty bones. We're talking like the femur.
Whoa, who shipped that to you?
There's some like antique medical device guy who has all this stuff, and I'm like, how do you have this? And it's kept in great condition too.
This is why, and look, there's like different grips on it.
Yep.
And I'm curious why this design.
A lot of questions that we are not going to answer because we are just going to try to amputate the gorilla's finger.
Oh, well, okay. I'm not a vet, so that's for you.
At this point, I've had the gorilla for about 2 months, and he's already missing one of his eyes. Don't be fooled by this. This pops off quite easily.
Oh, what happened there?
I'm just going to take it up a little bit, but it's not going to be too crazy. But I want to hide the fact that he was abused.
And we love gorillas.
We love gorillas. But if we do have this amputation saw, I should be able to get through his finger. I don't want to pierce him so he completely just deflates.
Oh, is it an inflatable?
Yeah, it's an inflatable.
Oh, it's going to deflate.
You think so? Yeah. If I just touch the plastic part?
Medically, I feel like there is some...
All right, so I'm going to just saw right through this. Oh, this thing is it's beautiful.
This one works better than the other one?
Wow, this is a nice saw. Like already a third through. Not even doing a lot of pressure. If I could do this without piercing
then you'd be a real surgeon. That's the accuracy you need. This is actually one of the final tests of surgery rotation to be able to take a giant inflatable animal and see if you can amputate a small part without piercing the rest of it.
So this is my final exam then, if I'm able to do this.
Separate the tissue, dissect, do a proper dissection.
Am I doing it right?
This is not right, but it works. Sometimes it's about functionality.
Oh, there we go. Beautiful. You know what? It's still gonna be separated there.
Well, I think what you did is you basically, let's pretend you did something else. Instead of an amputation, let's say that there was an abscess deep inside the hand. You opened it and you performed something known as incision and drainage.
Okay.
So you just opened it up and now it's draining and you're gonna leave it open to allow it to continue to drain.
So I helped him right there by doing an incision and drainage.
Yes.
So he had something in there and
Yeah, he had an abscess, a mean abscess in there. And
disgusting abscess, and now it's all draining out.
yeah, exactly. Pus everywhere.
Wow. So I actually wanted to hurt him at first because he's been, just imagine every time we record, he's just like looking over your shoulder. It gets old real quick. So I wanted to do something bad. I ended up helping him, but I guess that's what he gets.
That's good. You swore to do no harm.
Would you say this is like the nicest state-of-the-art thing we've looked at so far?
Yeah, I mean, this looks high end. To me, I don't believe that this is from that era. I think it's a replica of what those things look like in that era. But I could be wrong.
Moving on. So this is a fetal stethoscope, which you're supposed to put up
on the belly, and then you can hear.
And they said it's like non-invasive, obviously, because it's just wood.
You can't hear the ocean.
No, nothing from there.
Let's see if we can do a lung exam.
Okay.
Deep breath. God, it sucks compared to my stethoscope. One more. No.
No? Nothing?
Nope.
Do you think they were just like lying when they were like, oh, I could hear something?
I can't hear your heart. I feel like they were making stuff up.
You think they were making things up with this?
I think it's this way.
Oh, okay.
Yeah, okay.
Oh,
sorry. All right, deep breaths. Yeah, okay, so it's better this way. You could breathe normally. I'm gonna listen to your heart. Yeah, and your heart's beating pretty quick.
Oh, nice, okay. Apart from all the sawing I've been doing on a gorilla, I'm at like 120 beats per minute. Can I try to listen? So like, where would I listen?
So you wanna listen at PMI, point of maximal impulse. Let me get my parking ticket out of the way.
Right here?
Yep.
And I just, oh, I guess I do hear something.
You hear it, right?
Yeah, wow, that's cool. Okay, I don't know how to detect, like, if that means anything. It sounds good though.
Yeah.
Dr. Mike is
The heart is alive.
Heart is good. Well, this actually works, to my surprise. So good device. Whoever invented this way back then, you were onto something.
Yeah, you could hear the baby's heartbeat.
The next medicine we have is actually Coca-Cola, because in 1886 it was invented and marketed as medicine for 35 years until 1920, when it was then classified as a soft drink. But
What was the medicine component?
what it had in it was coca leaf extract, which is the psychoactive ingredient in cocaine.
Oh.
And so it would be used, ironically, to like help morphine addiction. I think it ended up giving people morphine addiction.
Interesting, okay.
And then it was also used to treat low energy, obviously. And now today, people drink.
Well, now people still use it for low energy.
True, yeah, I guess
People are
so.
addicted to Coke and Diet Coke for the caffeine kick.
Are you a soda guy?
I'm not a soda guy. I'm a sparkling water guy.
Nice, okay. So would you say that Diet Coke is healthier than regular Coke because it's obviously 0 calories and it uses artificial sweetener instead of natural sugar?
It's hard to decide what's healthier because it depends healthier for whom. So if you have someone who's over-consuming calories, over-consuming sugar, you want them on the Diet Coke. For them, that's healthier. And you want to encourage people to drink water, sparkling water, things that don't have sugar or added sweeteners. But if you have an added sweetener every now and then, that's not the end of the world. All these studies of people saying it gives you cancer, this and that, those come from animal studies where they give way more of a dose than you would be exposed to having a glass of that.
That sounds like pretty sound advice. Okay, Coca-Cola.
Coca-Cola.
So here we have a 1910s prosthetic leg that somebody for some reason was willing to ship out to me, so shout out to you. I don't know how exactly this would work, but it looks as if there's some hooks here and then they would just bind to your leg, and then with some...
There would probably be probably some sort of padding here to allow it to attach, and then you'd wear like the actual articulating portion of it on the top of the leg. And this is clearly for someone who has a below knee amputation, because if you have above knee amputation, it would look slightly different. But the point of it is just to create more articulation, to have a leg to stand on quite literally, and give people back their mobility, because a lot of folks that were coming back from war would have a limb that was either taken off in an explosion, would be taken off from us as doctors in the field, or perhaps as a result of infection that set in afterwards that they needed to have an amputation, and they would be able to get a prosthetic like that. Obviously these days the prosthetics are a lot more advanced.
But you're able to, you think, walk and put pressure on this and move it if you were...
It feels pretty sturdy. I think that it is within reason that you would be able to do that. that, yeah. I mean, I don't know if this specific model would. Obviously, this is 100 years before my time, but it looks legitimate. It looks worn.
Yeah, I think it was actually somebody utilized this.
That's pretty amazing that it has history like that.
These things always fascinate me. It's so cool to see the origin of how people first thought to repair amputated limbs or whatever.
Yeah.
Like, oh, let's create this, and then they put some thought into.
And the thought is like to make it look, have the appearance of their opposite limb. Some people say, oh, we'll function above all, but some people want to feel like that they have a normal limb, and they want to have the appearance of a normal limb, and it makes them feel more comfortable, allow them to stay independent. So taking into consideration form as well as function is really important with prosthetics.
Right. Wow, incredible. Okay, so this is the Franklin serum dose syringe, which in the early 1900s was used to apply certain topical ointments on people. So,
well, I get why the topical. There's no way to penetrate skin with that flat edge.
Yeah. So as Dr. Mike says, it is not a pointed syringe. So this isn't meant to go inside of a body, but rather to be used topically. I feel like this is a good opportunity to kind of make up for my wrong earlier, which I wasn't able to ultimately help him. So I think I have to heal things up.
Yep.
So this is a topical ointment.
And you have the measurements here, right? To know exactly how much you're delivering.
I do.
A little topical antibiotic. Oh, okay, well, that almost worked.
Ooh.
Oh.
Okay. I think this thing has been used in a while, so.
Okay, yeah, clearly it's aged.
Okay, he's getting a little bit.
We're getting it.
We're almost there.
It's filling in.
Hey, there we go.
there
Okay, then maybe one more
This
squirt.
doesn't feel accurate.
No.
Okay, there you go.
That's
And then
it.
you just finish the topical application and you allow healing to happen.
You know what? If this was actually not rusted and like a modern day one, I could see it being useful, right? Like just to.
Well, yeah, because if you're trying to figure out specific dosages, it's hard to squeeze on your finger and say, oh, I have a gram here or 5 grams here. But if you're using that device, you'll probably be able to be more accurate.
Very scientific.
And also, I feel like there's some kind of loose air in here. That air's coming out. That's why you're not getting a good stream.
Well, don't take any advice from me on how I did this.
Well, because we do injections. Like, for example, you see here, you have the clavicle meeting the acromion. That's coming off the scapula. There is an AC joint that sometimes people will develop arthritis in. And we can actually go in there and inject it, not with something like this, but with the traditional needle and syringe, and inject some steroid into there.
Hey, wait, is it AC because of the name? It's like, oh.
Acromion clavicular.
Wow, okay. All right, so he's good to go. We're gonna let him sit for a little bit, marinate, see if this heals him up. And in the meantime, moving on. So here we have a bloodletting device. This was used in the 1600s and 1800s to basically relieve extra blood from people's body, which was in part for humoral theory, which balances the different sorts of blood and what else?
Guts, bile, vomit, diarrhea, feces. So it was not a smart method.
So I'm going to bloodlet. Is that a verb? This unfortunate patient right here.
I mean, if you're bloodletting the neck, you're gonna run into trouble because the carotid arteries here, the jugular vein is here. They're gonna be bleeding out very fast. You're gonna kill them.
Okay.
Stroke.
Which I don't want for him.
Well, maybe.
Maybe. Well, where would you suggest is somewhere where I'm able to get decent blood flow that isn't?
Perhaps, I mean, I don't know where they did it, but maybe you could do across the shoulder.
Okay.
So you're staying away from the vital structures of the neck that are supplying the brain.
And then I just think it's an incision. Right?
Is that?
I mean, I
don't know.
This is what I would think. Here we go.
I mean, it's like a scalpel if you think about it.
Yeah.
I mean, it's basically a scalpel. It's a Swiss Army scalpel. That's what I would call it.
Swiss Army scalpel, what killed George Washington. Yeah, I mean, there's no blood in him. He's been drained completely, so he's got nothing inside of him, but there would be blood obviously falling out. I'm piercing pretty deeply. This incision is like maybe like a 1/4 inch deep. And then I'll just do this. Extra blood flows out, and then back then he would have been solved. He would have been healed.
Maybe, charitable thinking, he was suffering from polycythemia and he had too much red blood cells and you just helped him.
That's a very charitable way to look at things.
Maybe he had cancer, polycythemia vera, and you helped him.
Yeah, okay, I like that view. So in the early 1900s, they had a rubber enema irrigator, which you would fill with hot water, saline, or sometimes even coffee that people would then use to cleanse their colon. So what are your thoughts on this?
The enema actually has medical utility today. And obviously like this one is like really interesting because of how it's made. But in general, our enemas are quite similar to this. Maybe ours are plastic and not rubber, and they're just more of a syringe. Kind of similar to the serum syringe thing that we used. But the purpose of an enema is to allow disimpaction to occur. So someone's very constipated, this will help that process out. And what people don't get is from your mouth to your anus, that's one digestive tract. What's in your digestive tract is technically not even inside of you.
So if you had enough irrigation going through the so it would come out the mouth.
I mean, that would be very aggressive. I don't know if you can get that far, but yeah, you technically can. If you want to have coffee in your GI tract, drink it. There's no need to put it up your bum. So I love that as a design.
Yeah, they were pretty thoughtful back then. They're like, you know what, let's make this look nice. It's a good pattern on it. Unable to demonstrate because we don't have a proper test subject, but there is footage of Dr. Mike performing a rectal exam.
Yeah, I wasn't performing a rectal exam. I was teaching how to perform a rectal exam on the robotic bum, which is how med students learn, right?
Right, okay.
Yeah. So we start there and then we move to standardized patients.
All right, well, Dr. Mike, thank you for helping us save our patient right here, and just also going through with all the medieval devices, some of the ancient ones, and some that even may have some application today in some regard, but this was super helpful, super educational too.
I think it goes to show that we've made mistakes in medical history that we need to learn from and not go back to remaking those mistakes.
Right.
So that's why we preach evidence-based guidance above all.
This is by far probably the most education they've had on this
There you
channel.
go.
I made 3,200 videos. This one is going to serve as the most educational.
Well, there you go. We have to start somewhere.
Thanks so
Awesome.
much,
Thank you.
Dr. Mike.
The next medical device that we're going to be testing was actually popular in the 1940s during the beauty craze, and it is facelift tape. So the purpose of this facelift tape is obviously aesthetic only because it's meant to reduce wrinkling, tighten your jawline, and even get rid of some of the sag underneath your chin as you get older. And apparently there's decent temporary results from it. So it actually, to this day, I mean, this is one just bought off Amazon recently. It's an ivory colored one. People still use this. So I'm going to leave this on for the next 2 segments or so. I'm going to see if it has any sort of temporary lift to my face. People would do things by any means to have a good looking face. Okay, so this is interesting. Looks like a mask. Smells kind of funky. But as they say, beauty is pain. All right, so it's on. As you can see, it's pretty tight. It's kind of choking me a little bit, but I definitely feel like it's lifting up my neck a little bit. So for the next 2 segments, I will be wearing this, and then if I come back with a really chiseled jawline, you know it works. So also in the 1940s, when people were clearly optimizing for their beauty, they also came out with nose binders, which are meant to basically reshape or re-slim your nose. So westernized or European noses were apparently the most coveted ones, and so in order to shrink your nose a bit, they would put these clips on your nose, and then it would temporarily, and in some cases it would damage your cartilage and actually reduce the size of your nose. I don't even know if these are legal in the US, but I received these from Japan. And it's a very simple device. So it is just this, metal brackets on top, a little bit of silicone here for comfort, I guess. And then you do this. So my nose is plugged now. I am on my way to beautiful. So now I'm gonna have a reshaped nose and I'm gonna have a lifted face all within the span of like 20 minutes. But the beauty devices don't end there, because in the 1940s, there was also a dimple indentation device that literally pokes holes through your skin and tissue to create fake dimples. Now, if you don't know what dimples are, sometimes when people smile, you'll notice they have these little indentations like right above their cheek right there. I don't think I have any dimples, but I am gonna create some right now. People claim they're cutesy wootsy. I don't know about that. I think everybody's beautiful. Well, not everybody. There's some ugly people, let's be real. Kind of half expecting to pull out a needle here. Oh, okay. So this is it. Okay, so the idea then is to ultimately hold this on your face, and you're gonna see it's hitting the dimple area. I don't think it stays. All right, so I'm gonna hold this a little bit, and then when I come back in like 5 minutes, I'm gonna take everything off, and I'm gonna see if I revolutionize my body using 1940s beauty devices. All right, moment of truth now. It's been about 5 minutes, so I'm gonna take off this dimple thing because it's very annoying. It's kind of piercing through my skin. So let's see if I've created dimples. Oh, kind of. You could kind of see. Do I look cute? Do I look uwu when I have my dimples now? I think it's just red, so it doesn't look too good. Okay, but what about the nose? So you saw my before nose. Here's my after nose. 3, 2, 1. Maybe a bit thinner. I am not gonna lie, my nose looks thinner. Am I going crazy, or am I starting to look gorgeous? Moment of truth. Do I have a chiseled, perfect chin? I've had this on the longest, probably like 20 minutes now, so here we go. Wow, I feel like I could breathe. I feel like I could like go do anything. Wow, is it just me, or I literally feel a little bit better looking just from that? Could be a little bit of, you know, placebo, something happening, but I feel great as a result of putting those 3 devices on. I think I'm just relieved that they're off, but I actually do feel good. I don't know what it is. Maybe I'm getting lost in the sauce, but I like that. So I was actually able to get my hands on some really old pharmaceutical products like these corn and bunion felt pads from Johnson & Johnson. It says these pads are unmedicated rings of gummed felt designed to protect the corn or bunion from shoe pressure. So let's see what these look like. Okay, there's nothing in here. I guess these got like lost in shipping or something, so that's a little bit of a letdown. But what I do have here is Corosil ear and ulcer syringe, which just looks like this. So it kind of looks like this enema, but this is like kind of gonna be, I guess, like a separate irrigation device, which you put into your ear, which I'm not gonna do because this thing looks like rusted, and you basically clean out your ear by pushing through it. So it's kind of like a neti pot for your ear, which doesn't feel as nice because there's no sinuses in your ear, so I don't know what you'd be clearing out. I heard you're not supposed to get rid rid of your earwax as well. But nonetheless, they use this. I also got my hands on Fred Gibson's Pharmacy in Ohio. It says take one as described night and morning. And on the back is actually a prescription that was written out from a doctor a very long time ago. In fact, 1924, so 100 years ago. You'll never be able to read the doctor's handwriting. I don't know what it is, but doctors just have the worst handwriting. But this is what things look like. And here's one from 1957. It's just some more old medicine. This is a tablet. Take with a pint of water and compress as directed. And now we have AI. So in the 1300s throughout Europe, 50% of the population was killed by the bubonic plague, otherwise known as the Black Death. And physicians at the time, in order to not catch it because they believed it was airborne, would put on these masks right here. So yes, these are doctor masks from 700 or 800 years ago that you're looking at. It looks very creepy, and the reason why is because it has this beak, which they would fill with certain herbs and then like these vinegar-soaked sponges that would basically get rid of any potential airborne illness before it got into their mouth. So it's not just for design, despite the fact that these look pretty cool. And then on the back is just some leather straps, and you put this thing on and I guess you're good to go. Then it has some goggles here. You may have seen these resurface recently because during COVID, I think people started like wearing these unironically. But if you were unfortunately living during the 1350s in Europe and Asia, this is what your physician would be looking at you like. Imagine trying to take this person seriously when they look like a mosquito. And yeah, obviously it's called a bird mask because of the shape of it. Very scary, has like a leathery feel to it throughout. But in any case, here it is. Now you could look at it. So there you have it. So in the 1900s, during the beauty craze, there were a lot of medical devices that came out, but none greater than the caliper. This is a digital caliper, which is a more modernized version, but basically what this does is measure different proportions on certain parts of your body. Because in order to look good, you have to adhere to the golden ratios. If you've ever heard of like Fibonacci sequence and stuff, it's just like the perfect ratio between your eye distance, your nose to your mouth, and all these other parts of your body to figure out if you're an attractive person. So people would quite literally try to optimize for these perfect ratios. So they'd measure out, oh, my eyes are too wide apart, and then they would do certain therapies to try to bring them together. So the way the caliper measures is through these two prongs right here. Anything you put between here is going to be measured down to the thousandth place, and you could do millimeters, you could do inches. There's a bunch of different ways that you could measure it. So here we go. I'm about to shatter my ego completely. So it looks like the perfect ratio for men between their eyebrows is 30 to 35 millimeters. Mine looks to be maybe right there, which corresponds to, let's go, 35 millimeters. So in terms of my eyebrows, they're quite good. So I have decent eye distance. Now the philtrum length, which is between your nose and your top lip, ideally is 13 millimeters. Okay, so this is mine. I'm not joking. 13.35 millimeters. And then lastly, we have forehead height, which should be 55 millimeters, no more, no less. 55 is considered perfect. I'm probably on closer to 65 if I had to guess, because I have a larger forehead. Look at it. I kid you not. This might be the perfect forehead. You're looking at a prime forehead. Wow, well, tons of surprises there. I just learned I'm more attractive than previously thought, according to science. I don't know how like accurate these figures are, but I promise I didn't make them up. I fed them through ChatGPT, which now that I think of it is probably just making me want to feel good about myself, so then I'm like nicer to it when I prompt it. I'll take it though. Now in the 1700s, dentists would use this to basically pry and keep open patients' mouths. So during certain surgeries or if they're doing certain hygiene sessions, there's like a clamp here that you would put into your mouth, open it up, and then it would basically keep it open. I don't know how to properly use this. This thing just looks a little bit scary. It has springs too, which is always scary. Like, why am I having this in my mouth? I think it's actually locked for safety purposes because you're not supposed to actually use this and interact with it. No wonder the myth that the dentist is scary started. Imagine just opening wide and then this size is like, my mouth can't even get that wide, and you're biting on metal. Like, it's uncomfortable too. There's not even like rubber on top to help with the placement. Ugh, I feel bad for people back then. All right, guys, well, that's everything. Thank you again to Dr. Mike for coming through and educating everybody. This was actually a really useful session. I learned so much. It was quite fun. So thank you again, Dr. Mike. And thank you to you guys for watching. So if you want to see more content, make sure to click here, click here. Otherwise, subscribe on your way out, and I'll see you next time. Peace.